Jamaican healthcare for specifically retirees moving back home. Welcome, guys, to Shelly's Jamaican Bickle and Lifestyle. It's another Saturday, and your girl is working. Welcome to my channel. If you're new, don't forget to subscribe. Hit that notification bell so you won't miss a video upload. In this video, I'll be talking about the healthcare system back home in Jamaica. We know living overseas, it is not the best. Healthcare in Jamaica, it is not the best. It is now free healthcare, which we already know that we have a country that's already crippling crime, mental health, all you can think of in this life. So, free healthcare. Is this a measurable system, especially for people moving back home? I would consider more private than public. It is so alarming based on news and the views of people residing in that country, how impoverished the healthcare system is. One, a lot of investment has not been done to upgrade the hospitals, especially when it comes to like critical care. ICU, critical care, we know the crisis during COVID. Hospitals did not have ventilators. In Kingston, University Hospital of the West Indies is semi like private. And then you have Kingston Public Hospital. But isn't there a scare and isn't there a crisis? Because each time we listen, we hear about funds missing, the Prime Minister having, you know and I know, how many different accounts, but how much has been invested or put into the healthcare system in Jamaica. I used to work with nurses, and I can guarantee and tell you, during those times, a lot of nurses migrated overseas for better. One, the healthcare system wasn't really paying nurses as how they're supposed to be paid, just like now, not to mention teachers. So, based on the unavailability of not paying these nurses a good income, the facilities that they're working in lacking in things that we deem important and necessary in order to save one's life. There is a sad story going on right now about a little baby girl who was hospitalized at Bustamante Children's Hospital based on a tumor, I think, in the back of her eye. And it is so tragic, it is so horrific, it is so heart-wrenching how the father and the mother in this case has found out based on an external autopsy done that this baby was on life support at Bustamante Children's Hospital, but the baby had died based on a major surgery that was done to apparently remove the mass or to assist in aiding that this would not be affecting this little child. And the little girl died. The mother, the father was going there to visit to see this baby, hooked up in ICU, but this baby was a dead baby. And it was based on bringing this child's body after it was released from Bustamante Hospital out to get an autopsy done externally. Allegedly, it was stated that based on deterioration of the baby's body, bones, internal organs, they were like rotten. So, can we trust the healthcare system in Jamaica? One, to the per capita income and persons residing in Jamaica. Is Jamaica really in a state where it can offer free healthcare to each and every person living in Jamaica or who might be returning back home to Jamaica? It is scary. and it is a crisis. It's been a while. I haven't heard that they have done an overhaul of the healthcare system to try to maybe get equipments. A lot of the hospitals are without specific equipments. Certain procedures have to be done private. One. Two, some of the hospitals have to outsource services that should also be done at the hospitals. So, returning residents going back home, how are they able to cope coming from a country, another foreign country where, yes, maybe you have to pay lots for health insurance, and then to move back home in living in areas or in a country where the hospitals are not able to produce or to provide for the sick as they should. A lot of persons have to travel overseas to get help. Jamaica right now, I think, has one burn unit, maybe at University Hospital of the West Indies. We've seen how many times cylinders have burst open, cause fire, persons get burned, and they have to fly them to Miami, beg money to fly them to Miami to get help. I think it was a Burger King recently in Jamaica where there was a fire and there was some issue going around allegedly. I don't know what the outcome of that was, but recently in 2024 there was a huge fire at a Burger King, maybe in New Kingston or in Halfway Tree. But with a crippling economy and also not a lot of hospitals in that country, it is like really, really scary for people returning home. Or maybe the option for them is to go back overseas to get the health care that they need. But you never know. You might be there and be needing emergency help. I remember 4 years ago, or 5 years to be exact, we went to Jamaica on a vacation and my daughter fell ill, had food poisoning, and the first fight or flight was to go to Andrews Memorial. And that was where we ended up. Yes, we had to pay, but at least going private instead of going to the public hospital, we don't know what could have or would have taken place. So there's a healthcare crisis in Jamaica currently. And I think based on my views and my experience, I have a lot of nurses that I still communicate with working in hospitals. I love them dearly. A lot has migrated overseas. I still keep in communication with them, but the crippling healthcare sector back then in Jamaica when compared to 2024, I wouldn't even say 2025, it has gotten no better. It has not. There are less beds. Some of the times people are at the hospitals waiting 2-3 days to even get a bed. We've seen on the news, if we follow the Jamaican news circle like I do, how persons have gone to the hospital, they've been there for days, can't get a bed. By the time they are to get a bed, it's almost like to death, because the hospitals, one, they were not built to facilitate that much people. Two, they don't have sufficient nurses and doctors to attend to these persons. There are no beds. So how it's a really tough situation and a tough case when it is your health, and it is really, really scary with the health sector now in Jamaica. I don't even know if Christopher Tufton is still the health minister, but when was the last time you heard that investment was pumped or pooled into the healthcare system? Drop in the comment section and let me know your feedback. But I know, based on travel back home, a few times I've known of persons who fell ill, but they opt to go private because who wants to go sit at KPH all day? And if you go and you have a sick child, who wants to go sit at Bustamante Children's Hospital? Certain scans, MRIs, and stuff like that, the hospitals are not able to even able to facilitate MRIs. Either machines are broken down, or it is one machine servicing the whole country. Montego Bay, Mandeville is another nightmare. So many horror, so many sad stories. But it is cause for concern for persons returning back home. What type or what kind of healthcare system are persons really considering moving back home to? Maypen hospitals, if you check like each parish, there are like little, I would say medium-sized hospitals, but how upgraded are these hospitals? And as I clearly stated earlier, during COVID, 90% of the hospitals did not have ventilators. They did not have ventilators. I know nurses overseas were trying to raise funds to send back home to help with ventilators. From time to time too, I know persons who still send, and I am also contributory to it, send back home bed linen, towels and stuff like that. Jamaica is in a crisis. It's not only crime riddled, and it's not only that returning residents are being targeted, maybe based on the wealth that person see them having, but there is a health scare in Jamaica. Healthcare crisis. I don't know how, when, where, why, how. Jamaica is not able to pay nurses, but yet they offer a free healthcare system. So it's free live or free die, right? It's like really sad, and it is scary. Falling ill, going to the hospital. Then again, you have like persons with cancer getting cancer treatment. It's a whole day. Hospital in Jamaica is a whole day wait. My family resides in Clarendon, and I recall my sister had to go to the emergency room for whatever reason last year. And hours upon hours, and she works in healthcare. She had to be sitting in the emergency room waiting. One, there were no beds to even transfer a patient. Two, you have to sit in a hall, so it's like a slaughterhouse. Mr. Health Minister, I know I called on Minister of National Security. Mr. Health Minister, I don't know what is happening. I see recently there was a health fair where they're saying brain drain, and they've lost thousands of nurses. Now they were having a health fair trying to see if they can find at least 8,000 health workers in Jamaica, where we know the economic climate, and people would prefer to go overseas to work where, one, they are paid better, two, the experience. I can tell you Jamaica has good nurses. Jamaica has excellent nurses. As much as each and every one might have a different experience when it comes to first and going to get healthcare in the hospital for whatever reasons. We know us as Jamaicans, so we're feisty with this, and maybe it's due to the pressure that these nurses have to be working under. Why? When we go, we're not able to get that personal one-on-one care with a nurse because they're overworked. One nurse is dealing with maybe 10 or 15 patients, which is that in itself is like really, really hard. Computer system wise in Jamaica too, I've not been to KPH or any of those hospitals in a while. But when I used to live in Jamaica and worked, I used to go work in the hospitals to go market. The Credit Union, Cornwall Regional, St. Anne's Bay Hospital, KPH, Bustamante, you name them or you know them. Lots of hospitals I used to go to work to like sell products and services based on working in the credit union. And even then, it's literally a nightmare. And to see how people are suffering, yet they're calling nurse, they're calling on doctors, they're overworked, underpaid, overburdened, they're working with little to nothing. Not to mention Victoria Jubilee and maybe the loss of lives there due to one, negligence. I know recently there was at the Spanish Town Hospital where a 14-year-old girl went to give birth, and I guess the mother asked for surgery, and based on whatever, this 14-year-old girl died. So it is like really, really sad, like for people returning back home, considering our country, Jamaica, which I don't think the government puts a lot into healthcare, just like security, just the same. What type of healthcare system are you expecting to go back home to get? Is it one where you're able to go to a private hospital, or is it one where you have to go back to get free healthcare? Food for thought. Stay tuned for another video. Don't forget to like, subscribe, drop some comment, and let me know what you think about all these moving back home scenarios, situations, and how you assess them. Give your honest opinion. Stay tuned. See you in another vlog.